Greetings, everybody. It's Tuesday, the 14th of June, 2022. It's 5:05 p.m. This is the Advisory Board of Health special meeting. Our first order of business is to approve the March 2022 minutes, which were sent around, I believe, yesterday. David, I had two very minor edits to it, which I sent back to you. If there are any other questions, can I get a motion to approve those minutes?
I motion to approve.
Andy, second. Christine, great, thank you. David, over to you.
All right, so I'll start off with a staff update. As I'm sure you should know anyway, our office administrator is out on maternity leave. So we've managed to patch together coverage by utilizing our contact tracer, Cheryl Montoya, working part-time in the office, in conjunction with a high school student senior intern. For the past 4 weeks, we've had an intern in the office, and she's been very helpful doing a series of projects that I'll get into in a minute. But between the two and some admin being done by Mindy and myself, we'll stay afloat until Michelle comes back in August. Also, Paula has been out. She had a medical issue. And so we had a planned medical emergency response team that she had put together, was going to start putting together for town hall, which we were all pretty excited about. We had to put that on hold for a bit, and she was also going to do blood pressure training so that we could have a sort of a strike team in the town hall in the event of an emergency. That's something that we're hoping to get going very shortly. She's hoping to return next week. The other big thing that we're just getting started with is, in response to the recent suicides in town, Monica has assembled we'll call it a task force for now. It's in the preliminary stages, to be co-chaired by myself and Allie, the Director of Human Services. And we meet for the second time tomorrow. And what we're doing is pulling together professionals, behavioral health and crisis response professionals from the area. Especially important in that group is the Hub. We do a lot of suicide intervention, postvention, and so on activities. So we really want to have a very proactive program going forward in retaining in the future some behavioral health components of it. And I know that they're looking at using some of the ARPA funds to also pay for some of the additional counseling services that'll be going on for this particular program. Lot to do there, and details will be coming. We have to basically figure out how we're going to roll this program out.
Yeah, David, thank you for that. Yeah, it was just the last meeting prior to these suicides. I had mentioned something about the suicides. It's devastating.
Yes, it is.
Yeah, very, very devastating. And more needs to be done, a lot. And one of my concerns is that you might pass on to your little group is that personally, I don't think it real appropriate for post 53 to respond to their peers, high school other students, because it would be so humiliating to them. I'm wondering if there's a way that could be worked around, if there is a potential, suicide or psychiatric crisis. If there is a way, excuse me, just to send some adults out so that they're not facing their high school peers.
I'll make a note of that.
There are always adults and a paramedic adult on that respond to every emergency.
I know that, yeah.
Yeah,
It's
so
just their high school peers. Is that it's very, very upsetting for people. You know, I work in mental health, and for their
yeah,
peers,
no, I get it.
yeah, that's and I'm sure they could do an assessment. When they go in, the adults or the police who go in do an assessment, and then if they're a high school peer, maybe that they just kind of back out or something. So I don't know how you
That,
can handle it, but
that's exactly what they do, Christine.
good.
But I'm
Okay.
sure that will be part of the discussion. So I'll make sure I made a note of it. So, in tomorrow's discussion, we'll just confirm that concern, because it's tough enough to hear about it, but to actually walk in on it, if it's somebody I mean, talk about devastating, no question.
Yeah, definitely.
There's two components of our that's all I was going to say about that particular thing at the moment. This is brand new, so I don't have really anything to report on it other than the first meeting I will attend is tomorrow. I was away the first time they met. As to our budget, our operating budget, we're all set. We pretty much got what we asked for, except we didn't get the additional position. But we were assured that should the need arise over the course of the year, due to all the new construction, the new buildings going in, new restaurants, should the demand get to the point where we start really feeling the pressure of getting the work done, that Kate has agreed to relook at the adding more hours, part-time position, or more funding to help with staffing in that regard. Can talk a little bit about the other part of the budget, which is the ARPA funds. That was also approved to give us the new software program, which we will start working on when Michelle returns from her maternity leave. I don't want to start working on it now, take that chunk of work on, but we'll start doing that. I'm really excited about expanding the service to the residents and enabling online payments and all of that, and permit applications. So, it's about time we get into the 20th century, 21st.
Right.
And then Kevin, I think, would like to kind of go over our pod in the box, which is also another pretty exciting thing that was approved, so that we could respond in a very timely fashion should another crisis show itself. So Kevin, you want to go over that?
Yeah, thank you so much, David. So ARPA, David and I were on the ARPA committee, and we jointly submitted a proposal for a project that essentially what it is, all the things that we used for our
Well, now, can anybody else hear him?
Oh, he just kind of stopped when he said all the things.
Yeah, he closed his eyes and he's gone. So, pod in the box just would entail buying a trailer that would contain all the elements that we would need to stand up a clinic in remote locations. And he and primarily Nick and Jocelyn, who is our emergency preparedness consultant and coordinator, who is so key to having our successful vaccine clinics, would work together in putting together this as you call it, pod in the box. Nick has done that before in previous employment. when he worked at another regional, emergency response project in Virginia, I believe. So he's had experience putting these things together. And of course, Kevin, we all know Kevin's experience in this field. So I feel that this would be really great for the town to be able to have something ready to go if we needed it. We obviously knew how to put one together in the town hall, but who knows if that facility will always be available to the degree that we had it. Hey, Kevin.
Sorry, my computer hates GoToMeeting, so I don't know what happened. So now I'm on my cell phone. So I don't know how much of that you got. But
You know, I just kind of talked about, you know, the background of Nick and putting together a pod in the box before, and of course your experience, and certainly you can kind of go over it again, your perspective.
Sure. So apologies for that. Essentially, all the things that we need to run a pod, whether it be a vaccine clinic, medication clinic, handing out PPE tests. In this instance, we had over a year to prepare for it, but there are certainly instances where we could get a push package from the CDC Strategic National Stockpile. I think they send those out in, what is it? It arrives in 48 hours, Dave, and we have to be ready in 72. So whether it be mass distribution of antibiotics, antidote, vaccine prophylaxis, those type of things, we will have much less time. So the idea is to get all those things, those materials like clipboards, pens, paper, tables, all the things that we needed to run a clinic, regardless of what we're giving, and have them on hand ready to be easily deployed, because the last thing you want to be doing is responding to a health crisis and also separately be getting all those things, procuring all those things. So we would have them all on hand in a trailer so we could inventory them, keep them locked up, keep them on site, and if we needed to, we could move them very, very quickly. But again, this is a project I worked on when I was at the New York City Department of Health. We called them pod in a box. So essentially, you just have these rolling containers. You roll them out to a gym or wherever you're doing your point of dispensing, and you take them out of the box and you go. Signs, tape, staplers, everything you could possibly need to run an extended clinic, you could be up and running very, very quickly. And the plan is to get all this stuff, have it stored centrally. We'll put together a protocol for deploying it, for inventorying it, for standard usage protocols. And we'd actually like to kind of use it. So get together maybe a drill or two once it's all gets together, so people know what it is, know how to use it, know how to deploy it, those type of things. So it's going to be a bit of a kind of logistically, Nick and I going out, getting all this stuff, packing it up, putting it in the trailer. But once we do that, I think it will be well worth it. And the ARPA committee approved it. The Board of Finance approved it. The RTM approved it, all unanimously. I wanted to just at least bring this this kind of project to this group for review and approval, because I think that's really the kind of the last step in we start buying this stuff. I'm happy to send around kind of what it is that is in it. I wish my computer were cooperating. But essentially, it's, there are a couple of computers. Those computers we need for both inventory control, but also, if you remember, the vaccinators were all online, and they had access to the online VAMS database, so they could enter all that information in. We could also use those computers for our emergency operations center. There are a couple of radios, there's some computer accessories and equipment, and really the bulk of the actual things is the actual trailer. And then again, extension cords, power strips, stanchions for queuing, tables, chairs, a canopy if we had to be up outside, a generator, clipboards, pens, pencils, all the type of things. And again, based on my experience in purchasing this stuff for New York City and Nick's experience for doing a very similar project for the state of Virginia, we've kind of agreed upon a standard set of things that we'd like to have in this pot. And again, it's been reviewed and approved at a number of levels, but I think the end price tag is about $180,000 again to be used from ARPA funds that was approved. And I think it's a real, it is well worth the time and money and effort spent. So we don't have to be procuring all this stuff in the event we do next time have something where we have to put these things together very, very quickly.
I think this is an excellent idea, Kevin, and I'm really in favor of all of that. It's wonderful. I have been a disaster nurse with the Red Cross, plus worked for AmeriCares for 8 years on our mobile clinic. So it's wonderful to have all those things in advance, get everything all ready, because you never know when an emergency happens. And I think it's really good planning. Thank you for doing that.
Pleasure. Thanks for the feedback, Christine. I really appreciate it. Anything else?
Well, from my perspective, to have it be instantaneously available is it's just a tremendous asset. To try to have an immediate response and pull stuff together. Like Kevin said, you know, when we were standing up the COVID clinics, we had about a year to assemble and get ready, you know, to figure out where we were going to get computers and stanchions and put it all together. We did have time. And that may not always be available, and this will enable an instantaneous response. So, yeah, I think it's great. And thanks, Kevin. All right. I don't have anything further to add about the budget. Let me see if I could do a little screen sharing here. So, a little COVID update. Case counts decreased again. This is on the first page. This is really interesting, but there's under the third item below. Of course, you know, we're again going back. The report is all based on laboratory confirmed test results. No at-home test results are involved. So, you know, certainly the numbers we have do not represent the full scope of the situation, but they do indicate trends. And the important thing is, like in the first notation below, case counts decreased for the 4th consecutive week. Those are confirmed laboratory tests. Positivity rate has also declined. And in Connecticut, there's a link in the third one that ties into the most recent State Health Department COVID website reports. And that has a tremendous amount of information in it, including hospitalizations on a statewide basis. So I encourage you to take a look at that and just to see what's going on in the state. But the important thing is that case counts have been declining. We are in the process also of just get out of this for a minute. We're also in the process of developing an after-action report for our lead-up response and how we addressed the COVID pandemic. We're going to hopefully have that ready by the end of July, finished by August, and a full report to this Board of Selectmen in the town, certainly by the end of August. So complete analysis of, what we did well, what we need to do better, and in part, maybe how we can maybe utilize the pod in a box. But that's a project that we're working on.
David, are you writing a book about this?
I suppose we could.
I'm kidding.
No, I mean, there's so many components of it. There's so many ramifications. So much happened. But I think the important thing is what did we learn? Because we've spent years planning, pandemic planning, right? We've written books on pandemic plans. And when this pandemic came along, I don't think that anybody looked at any books that were written before, and we figured this out as we went. This was a complete, figure it out as you go type of thing. And, I think a lot of times that's what we are faced with, And so I think that it's worthwhile for us to stand back, take a look at what we did, how we did it, and, and in essence, even thinking about going forward, because the pandemic is not over. I mean, the numbers are getting better again, but we don't know what's ahead of us. And each time and I'll confess to this, each time I get optimistic, it seems like, yeah, okay, things are getting good for a while, and then all of a sudden a new variant comes along and it upsets the apple cart. So, I think that this is part of our discussion, and we maybe shouldn't call it an after action report, but yet kind of an analysis of what we've done and, what we may be faced with in the future. And I could see how, again, this pod in the box fits into that. But that's a project that we're going to be undertaking. And also, just so you know, at this point, we do not have plans to offer vaccine clinics at this time, either booster clinics or any of the vaccines for the 6 months and older group, the new age group that is pending approval. We don't have the resources to do that group. And, our volunteers are very uncomfortable with working with that age group. And I think it would be a potential liability for the town to take that on without specialized vaccinators. And we really don't have that resource. So I think we did well with the age group we had and the age group we've served. But I think this is a more specialized target audience, and I don't think it's appropriate for us to do that.
I think, David, didn't you point out in your report that there's something like, is it 100 places within 5 miles of Darien? The ability is really growing.
Sorry.
There are a lot of choices available, and we'll make sure to have that be front and center on both the town website and our websites and all the other social media outlets that we have availability to, so that people know where to go. I did get a call the other day from a frantic mom who, just basically was crying on the phone. I don't know where to go. And so I said, well, the place I would go would be to look at the websites because they're all listed. And, oh, okay, well, she didn't know that. So that's the type of information we need to get out to folks. So at this point, we have no real plans to do any vaccine clinics, but I said that before. I didn't know that we would be doing boosters, and we ended up doing them in the fall. So we're ready if we have to. And we have a great cadre of volunteers, as Mac and Kevin can attest. You guys are great. Thanks for coming by. And Kevin, thanks to your wife for helping out. Mm-hmm. Other things, new initiatives. We have a few things that we're working on. One of the projects we gave to our student intern was to take a look at our health needs assessment that we did in 2016, 2017, and go through statistics that are available to see about updating that. So she spent the past 4 weeks working on that, gathering data. There's some updates that we're working on. Again, that's a project that we hope to get done within the next few months. She had a great start on it. And part of that, we're working with Norwalk Hospital, doing a health needs, part of their survey for their health needs assessment. And this high school intern has gotten us into the 21st century and created Instagram and Facebook accounts for the health department, posted the survey, and has posted several other things on Instagram and the website, including, let's see, a new video on ticks, on cosmetology inspections. We did an update on the prescription drug drop box. I spoke with the police officer, and they're still collecting, 45 pounds a month of unwanted meds at that drop box. So it's still being used. I'm pleased to hear that. So, but, we wanted to update that information because people are getting a little confused about what to bring there. They're trying to bring sharps, needles, and they can't, we can't take them. And we also can't take liquid meds, and we can't take, and we really don't need to take over-the-counter meds. Over-the-counter meds can be disposed of in the trash because our trash isn't brought to landfills, it's all burned. Liquid meds also in the trash. And sharps, our advice on how to just safely dispose of needles and sharps would be to put them in a like an old heavy-duty empty laundry bottle container. So put the sharps in a laundry container, duct tape the top, and throw it in the trash. It's not recyclable. That plastic is not recyclable at that point if it's got sharps in it, but throw it in the trash. Let's see, what other things? Oh, we have more plans to do for outreach on the Instagram page. I did a video for the introduction of the Thriving Youth Task Force program on marijuana and marijuana awareness. I suspect that we're going to be involved much more in marijuana and trying to get information out to the public on marijuana over the next few years. I think that's going to be an ongoing issue. And the other thing is, I know there's a lot of surveys going around, but we'd like to try to get an idea as part of our health needs assessment and as part of just what in the mental health component of today, survey residents for their pre and post-pandemic experience. What type of impact has the pandemic had on, home life, on kids, on schools, on work? There's been, so many things have changed with the pandemic. So it's to do these health needs assessment without taking the pandemic into account. To me, it doesn't make much sense. And the hospitals, with their health needs assessments, they're not really doing that. They have a template they're following, but I think it'd be really interesting to know, and it's going to take some time to develop a meaningful survey on how to assess that, the impact of the pandemic on our mental health and our processes on a regular basis. So, but that's something that I think would be a worthwhile project to get involved with over the next few years.
Also, David, for the health needs assessment, are you going to be asking or surveying kids, especially about community violence and how that's affecting them? Because I know in the schools, that I'm in, kids are really, really scared sometimes to go to school. that they're going to be shot and having these lockdowns and whatnot. It's really very traumatic for them. And then to hear of the school shootings or other mass shootings, and I'm wondering how that might be looked at in a needs assessment and what we could do about that as well.
Well, that could be part of that question, is how things have changed over the last few years, or is there that level of concern of violence? I know that the Thriving Youth Task Force was done, a little while ago, and it also doesn't take into account that whole suicide piece. So, we have a whole bunch of extra things that are kind of impacting our world right now that maybe we didn't have a couple of years ago, between the pandemic and our recent events. And really, is there any relationship between the recent suicides and the pandemic? I don't know, and I don't know how we'd evaluate that, but that's going to be part of this task force and part of what we're going to be trying to find out. Yeah, so the health needs assessment this time it's not something that we're going to be doing too quickly, because these are kind of areas that we're going to have to be very, very careful with our questions and how to understand what results we're getting from the questions we're asking. But I'm certainly would appreciate any kind of input and feedback, and would be working with you folks. Before we put anything out, I'd like to circulate what it is we're planning on doing with you, so that you can provide your input, suggestions.
Yeah, good, thank you.
And the other thing that we have coming up is we're going to have to be doing some revisions to our regulations. In particular, probably starting with food. I know for years I've been talking about the state modifying its food protection program to bring it more in line with the federal program, FDA food code. They keep telling us, they being the state, keep telling us they're getting closer to that. So my guess is that this might be something that's going to happen within the next year. And at the very least, we're going to have to come up with some new definitions and some changes in our own code, not just for that, but also there is another change that I've been involved in a committee, statewide committee, working on doing reciprocity for itinerant vendors. What that's referring to are these food trucks that kind of go from town to town, that show up maybe at Weed Beach or Tilly Pond, or these special events downtown. The way it is now, every time these trucks go from one town to another, like even in Darien, we have a regulation that says they have to get a permit every time they set up in every town they go to. So that means, if a guy goes to, or a truck goes to Norwalk and Stamford and New Canaan and Darien and Westport, you have to get permits in every town. So there was a law that was passed a couple of years ago that required the commissioner to work with local health directors to come up with a reciprocity program. And we've been working at it for the past 6 months. And I think we're pretty close to having one. And I would like to be in the pilot to actually run this, so that, and the way it would work is if a vendor gets a permit in say, let's say Norwalk, and they have a Norwalk Health Department permit and a recent inspection form, all they have to do, that would be posted online, because this is part of it would be an MOU, and the state health department would provide a database so that all the communities that are involved in this and agree to do this would be able to access a database to see which vendors are licensed, where they're inspected. And if they come to Darien, they don't need a Darien license if they've gotten a license in Norwalk and a recent inspection in Norwalk. I mean, we only inspect restaurants quarterly. Some of these trucks get inspected every week and they have to get a permit every week. So it's kind of makes sense. It really makes sense to do this, but it runs counter to our regulations. So I'm going to have to modify our regulations at least to accommodate a change to enable us to participate in this reciprocity program. And that is in the fast track to be at least considered to go into effect on July 1. So we'll be looking at that, and I'll be bringing that to you in September. But I think it makes good sense. I don't think there's real risk to the community in us doing that. And I think one of the things that it'll do is it'll enable us to see inspection reports that other towns do on trucks, so that we can see a history of trucks. Right now, if we do an inspection on a truck, no other health department has access to those records. So it's a means of cooperating with other departments and working with the vendors to simplify their lives greatly. You know, we've had some guys come in, they have 10 permits, $150 a pop. So anyway, that's I think, oh, the other thing I wanted to mention, in addition to the town hall Merton blood pressure training, we have AEDs in the town hall, and we've added Narcan to the AEDs. Sign of the times, folks. So, and that would be part of our training program for the MERT, is to have everybody understand how to use that stuff, how to use the Narcan, how to use the AEDs, and hopefully be able to be in a position to better respond if an emergency happens in the town hall. Knock on wood, we've had good luck. Hasn't really happened, but it could happen anytime. And I think that about covers everything that I wanted to talk about.
Great. Any discussion from anybody? Okay, I appreciate very much everybody's time.
Yeah,
We'll-
I'm really glad about the Narcan. It was just about a week ago. I was at a traffic light and coming from Stamford into Darien, and the car was just stopped in front of me and wouldn't move. Everybody went around. I went around and I saw the guy was slumped over the wheel.
Oh, geez.
So, yeah. So I jumped out and he wasn't responsive. And, tried to, and I'm thinking like, oh, I had Narcan in the past. I gave it away. And, I don't even know how a person actually, we can, as, civilian people, or, I'm a healthcare professional as well, how we can get Narcan for something like that. It's not in town hall, but it could very well happen somewhere in town hall too. So is there a way that we're able to, the police, remember, gave out Narcan in the past where we had that at the library. Is there a way to get another, dose of it to carry on our person?
Stop by the office.
Okay, thank you.
We have Narcan, and I think we have plenty of Narcan. And we also have COVID test kits, if anybody's interested in COVID test kits.
I have plenty of those. As a matter of fact, there were 2 people here in Darien, again, within the last couple of weeks, one of whom had symptoms, coughing, nothing real severe, like in the chest. And I said, well, why don't you do a home test? He didn't have one. So I did a home test with one of mine, and it was positive. So yeah. And his roommate, I also did, and it was negative. But and it's interesting, with all the information out there, they didn't really know how to proceed with the positive, at home test. So, I told them to go, call his doctor, get a PCR and whatnot. And, they prescribed them medication for him. But it's really interesting. Some people just still aren't aware of what to do if they have symptoms. He didn't think he had any symptoms, really. I mean, just a cough, a little bit, congestion. That was about it. So I've done so many at-home tests. Okay, I've done a lot of them, you know, and at work, you know, for people. And actually, that's the first one I saw that was positive. So
Yeah, and that's one of the things that we also put on all our social media is, what if you test positive? What are you supposed to do? So, you know, and no matter how many different venues you use to try to get information out, it seems you just can't catch everybody, you know? So, you know, we want to make sure that people know where to get vaccinated, where to get tested. We still have our 2 test sites, the one in Leroy. It's not being utilized as much as it had been in the past. St. John's Church, also on Post Road, that's open still 5 days a week. That's been used pretty well. So we still have that going, and of course all the vaccine locations, and we try to have all that information as readily available to the public as possible.
yeah, and I'm wondering also, you know, I've thought for the longest time, I would love to see a health education column in like the Darien Times, especially for some of the older people who might, you know, not be on social media. It's something that, you know, is something of interest, you know, some kind of a health matter issue, one of which would be what to do if you were COVID positive or you have symptoms, you know, which is just a repeat of what you have on the website or elsewhere. But I think it might be good. People could clip it out and put it on the refrigerator if they want, if they have a problem, or any other kind of health issue that comes up. I thought it might be good to have a health education column. And sometimes I feel like writing something a letter to the editor about certain things, but I haven't done that yet. But it might be a good idea.
Well, all we need to do is get an educator on board, right?
That's my master's is in health education.
Well, I mean, you know, so, you know, I don't think it necessarily, you know, I had, when Dr. Moore was our medical advisor, he periodically would put articles in the paper. But, you know, I mean, it's everybody's busy with their jobs. And so, you know, unless the town did hire a publicist. So we have spoken about doing certain, you know, public health related items, you know, including tick awareness. What do you do, you know, if you have a tick? And of course, what you do is right now, if you do find a tick on you, we've initiated and still maintain a relationship with the Connecticut Agricultural Experiment Station, where if you go to our website, there's a form that you can download and fill out and mail it with the tick in a plastic bag, sealed plastic bag.
Right in there, Huntington Street.
We used to ask people to bring the ticks into our office, but no longer. You save yourself a trip and just go to our website, download the tick form, and mail it in directly to the ag station.
Give it to me. I work right by it up there in New Haven.
What a great resource that is, the ag station. They are fantastic.
Yeah, they are. They're terrific. I mean, I called them about other, you know, things, and they're wonderful, really wonderful up there.
Really knowledgeable folks. Very helpful.
Yeah.
All
So
right.
the thing about the health education, just as a little thought, I'm wondering if that would be something even a high school intern might want to do something on as a project, doing some, you know, health education information for the newspaper.
Yeah, well, we just have to be careful with, you know, what they come up with. And she kind of has actually some of the stuff that if you look at our Instagram and Facebook page, please do, because that is some of the work that she's done.
Yeah. Well, just not her, but I mean, in the future, going forward. Yeah.
I know, but you know, writing is a tricky business, and to have an article written, I don't think I'd really want it to be done by a high school student, frankly. I pay attention to words, and it's really, you know, I don't think that's appropriate for high school students.
Really? No.
Well, David, maybe what the intern could do would be more, act more as an editor, find something and then show it to you, and then you sign off on it.
Well, there's no shortage of topics, that's for sure.
Yeah, I mean, often there can be like a template also too, you know, so many people, you know, whatever.
There's no shortage, and like I said, probably the most important one right now is the one, what do you do if you test positive? And, you know, that whole scenario, and a lot of that is cut and pasted. You can cut and paste from CDC. Right. And she'll be there for the summer, so we could have her do that kind of stuff.
David,
Folks, that's it for me.
hear me? David?
Yes.
Oh, at my office, we used to be able to get pre-boxed articles to put in our newsletter. Does anybody have those that you might be able to use?
Could you repeat that?
Okay. We used to get these articles about dentistry. There was a company that we used that sold articles, and you buy it and you put it into your newsletter. We got a newsletter from our office. It's pre-boxed. You know. That might be another way.
And would you think that would be something that would be put in the newspaper? How would you get it out to the public?
However you want to use it.
I'm sorry?
However you want to use it.
Right now, I think that we live in a society that is very social media oriented. So I that's one of the reasons why we did the Instagram and Facebook. So because I guess word has it that that's a pretty vibrant, you know, news exchange media in town. So.
Well, that's the social media is great, but I think we need a variety of modalities to get it to all sectors of the, you know, population. As I say, you know, a lot of older people are not on the social media or not technically savvy. So I think, you know, it's still written in print somewhere on the newspaper is still a good idea.
Yeah, and I don't disagree. I don't disagree. But, you know.
Or the other thing would be through the At Home in Darien, you know, something, you know, more to be more involved with them, and they'll reach an older population that way.
Yeah, I get notices from them for input into their newsletters.
Oh, okay.
And, you know, also with the senior center, we could do that.
Mm-hmm.
Good idea.
Okay, gang, unless there's anything else, our next meeting is Tuesday, the 13th of September at 5 p.m. We will send out an agenda and certainly minutes well before that. Again, I thank you all very much for your time, and we'll talk to you all soon.
All right.
Okay.
Thanks,
Thanks
folks.
everybody.